Hi, and welcome to Beauty Curious. My name is Dr. Elise Love, and I am a board-certified dermatologist.
And I'm Ian Michael Crum, a licensed esthetician.
Ian and I are excited to become your trusted beauty guides, from interviews with the best and brightest names in the industry to sharing our favorite expert-approved products.
We are here to help you navigate the noise by giving you the facts. Are you feeling beauty curious? Let's dive into today's episode.
All right, guys, I am incredibly happy to be here today with Dr. Lafer to discuss an incredibly hot topic right now, and that is plastic surgery. So Dr. Marissa Lafer is a board-certified otolaryngologist and fellowship-trained facial plastic and reconstructive surgeon. She specializes in both surgical and non-surgical facial rejuvenation, as well as cosmetic and reconstructive procedures on the nose, face, neck, and eyes. Dr. Lafer is recognized as a 2024 Castle Connolly Rising Star, making her third consecutive year receiving this honor. I was introduced to Dr. Lafer by a mutual patient, and as you could probably guess by the fact that I invited her on the podcast, my patient looks fantastic.
Yay.
Dr. Lafer also introduced me to a technique that I wasn't familiar with, and so it's been really great just like co-managing this patient with her, and I'm really confident that she's up on the newest and latest techniques in plastic surgery. In this conversation, we'll talk about the rising popularity of facelifts, why celebrities are opting for facelifts, when is too young to have a facelift, and tips on how to prepare and what to expect from a facelift. We'll also kind of dive into the rising controversies regarding hyaluronic acid fillers.
Awesome.
So
Thank
excited.
you.
Welcome,
Yeah.
Dr. Lafer.
Thanks for having me.
As Dr. Love said, we're super excited to dig into the conversation, and I think we should start from the beginning. So can you share a little bit about your journey into facial plastic and reconstructive surgery? Was there something that inspired you to specialize in this field?
Yes. So I loved surgery when I was on my medical school rotations. It was something that I really felt inspired by. I love to be able to have a problem and fix it. So that's where I kind of ended up in the surgery route. My father's also a surgeon, retired now, but he was an otolaryngologist as well. So we have a lot of fun times chatting about medicine and cases and all sorts of stuff, which is really special. And then when it came down to residency, I really loved the head and neck anatomy. I thought it was super interesting, very complicated, always learning something. And so that's where I ended up in that direction. And then finally, facial plastics, these were the most interesting cases to me. They're complex, they're thoughtful. You get to spend more time with your patients. You can really feel like you can understand what their needs are, address those specifically, and help them just feel better about where they're at. I do a lot of nasal reconstruction, so I do a combination of functional and aesthetic surgery, especially for the nose. And it's really fun to be able to see people over time as they heal and doing better and feeling great about themselves.
Amazing. I know you just mentioned procedures on the nose, but are there any other procedures that are super common or you kind of do on a routine basis?
Yeah, so I see a lot of different patients. I see everywhere from newborns for the ear molding all the way through the teenage years. Those common procedures are rhinoplasty and ear pinnings also. And then I see like the young adults, and then I get to the aging face patients. So blepharoplasties, facelifts, which we're going to hit on a bunch today. And those are kind of my most common things that I do.
I'm actually really excited about this conversation because even though I work in the aesthetic space on the dermatology side, there's actually not a lot of overlap between plastic surgery and dermatology. So I don't know a lot about the surgical side. So this is just going to be helpful for me in talking to my patients. Are there any trends that you've seen in plastic surgery, like in 2024, early 2025? What are people doing these days?
I think it's different. So in New York, I think we're really pushing for natural aesthetic. So we're doing filler, but we're doing less filler. We're thinking about, we're doing Botox, but we're not freezing people to death, right? There's a nuance there. And I think that's where it's nice to have somebody with a cosmetic mentality to really think about kind of the overall aging process and how we can help boost people to look just like the best version of themselves at this age, right? You don't want to take a 50-year-old and try to get them back to when they were 25. You know, when patients come in and bring those photos with me to share with me during their consults, I'm like, you were quite beautiful. Like there's all these moments, but it's really hard to kind of go through that aging process. And so we really talk about like, what are our goals today? Like, how can we make you look the best that you can today? And most people, especially in my practice, like they really want to look natural. They want to look, I send them to the estheticians, like we work together. I send them to my derm colleagues. I send them to all these different people to help their skin look brighter. Sunscreen, and to kind of help prevent, right?
Talking
Retinol, sunscreen, mostly sunscreen, also retinol, And I think what's really nice about that is that we can kind of work together and come at it from different angles to help people look just like bright and refreshed. People want to look like they look rested. They don't want to look pulled. So I think there's difference in techniques in terms of like what's happening in the last, handful of years. People are talking about techniques to make the face look more natural after surgery. And that's something that I'm sure we'll chat about too. But really, like in the rhinoplasty world, I say I have a lot of people who say to me, like, I still kind of like my bump. Like I like the bump on the profile, but I just don't want it to be like my whole face. Right. So then we go through iterations and we show them like, this is a straight profile. This is something with a little bit of fullness. This is a lot of fullness. Like, where do you follow it? Like, where do you see yourself? Where do you see your nose looking? And I think that's been a big change too, especially in my practice. I think people are not coming and asking for the big swoops like they used to be doing. And it ages really beautifully. And I think that's where we're really thinking too, is like the person who's 16 years old wants a different nose than when she's 50. So when I'm seeing those revisions and with the 50-year-olds and like the 35-year-olds who did their surgery so many years ago, they're really thinking about a different aesthetic. So my goal is to kind of keep people in line so that for the rest of their life, they still look good.
I think that's also beautiful because there's been also this talk about how in the aesthetic space, people are losing their ethnicity. Like we know that different ethnicities look differently. And then there's just kind of been this like one ideal of beauty. It was like, this is what a beautiful nose looks like. This is what cheekbones look like. This is what a facial shape is supposed to look like. And so I love that we're getting to this point where you can say, I love this thing that is unique and different about me, but I just want to soften it, or I just want to feel, like I just want to smooth it and make it feel more beautiful to me, but not that I'm trying to like fit into this aesthetic box that only has one definition.
100%. And this is something that I often have conversations with the residents that I'm teaching and the fellows. I say to them, like, you have to look at the person and their whole face, their background, like what their goals are. Obviously for their nose, you really want to make sure they can breathe, because a beautiful nose that you can't breathe out of is a terrible nose and patients are still unhappy, right? But once you get beyond that functional stuff, you really have to look at the whole person. And you can't create, it looks odd. You look at somebody and they have, a different ethnicity than the nose that you put on their face. It looks silly, right? It stands out as like not looking normal. And so, just to have people feel like they can embrace like who they are, what their background is, and be able to find what their goals are and address like their concerns, and not like my version of beauty, but their version of what they are hoping for, is amazing. And I think you're right. That's a big trend. Our like classic, what we're taught about in the books about what beauty is based off of like a subset of patients that is not applicable to everyone worldwide.
So lately there's been so much chatter about celebrities, particularly Lindsay Lohan, who's 38 years old, and Kylie Jenner, who's 27 years old. The accounts of them like having a facelift haven't been confirmed, but they have been looking, significantly different recently. So it's been speculated kind of all over the internet. When is too young to get a facelift?
So it's a really hot topic right now. You're right, Lindsay Lohan. And people bring that up all the time to me. They're like, do you think she actually had a facelift? What's happening? My view, I'm conservative. I'm a less is more person, and I'm not right for everybody, but that's my aesthetic, right? I think too young is like before 40 for sure, and really kind of before 45. And I don't like to be like an ageist and say like this is only right for this age and it's wrong for this age, but I do think it's a good guiding principle, because your facial changes aren't so dramatic in your 40s. It might feel like it, but it's not until your late 40s that things start to really change. And I have people all the time that come to the office and like, one day I looked fine. I woke up the next day and I'm unhappy with this, right? And I think that's important to think about. Oh, yes, there is a subset of people who it makes sense for at younger ages. I'll tell you, like the patients who've lost a significant amount of weight, no matter how old they will have stretched the skin and then they have sagging skin. And in the same way that they're candidates for abdominoplasties, right? So, taking care of the belly or breast lifts or leg lifts, body lifts, the whole thing. They're also a candidate for a facelift because you're having the same problem in your face that you have in your body. So younger, maybe. The other issue is if you put a lot of filler in, which some patients have and some practitioners advocate, they'll do a lot of cheek and yes, it hides the jowls, picks up the jowls. But then what happens as you get older, you continue to age, the skin stretches, and then all of a sudden, if you let it go, you need more and more and more to camouflage the jowls. So, maybe Lindsay Lohan, I don't know what she did or didn't do before, but it's possible that she had maybe some augmentation of her face. And then as that sort of went away, either by itself or was dissolved, there was perhaps some sagging skin that she took care of. But in general, I think it's too young.
And do you have patients coming in, whether it's for facelift or a nose, and they'll bring you like a photo of either Lindsay or Kylie or any celebrity, and they're like, I want that, and then you have to kind of
walk them back,
guide them away from being like, well, maybe that nose doesn't fit your face, or whatever feature they're asking for.
Yeah, I always like to bring people back to them and their face. Like, if somebody's 6 foot tall, it's different than if they're 5'1" too, right? Like, how much you can turn up the nose is different. If you're 6 feet tall and you're looking up somebody's nostril, I mean, that's not super attractive.
Super interesting. That's a very interesting point. I've never heard of that. Yeah.
Oh, you're welcome. Tips right here.
That's really makes a lot of sense. Yeah.
Right. But if you're 5'1" and you're very petite, you could turn up the nose a little bit and it's sweet looking, right? It's attractive, but you don't want to be looking in somebody's nostrils. Okay. So yes, there's lots of conversations that I have with people. It's not uncommon for them to say like, I really want this nose. And then I'll say, this is what I think would fit for you and your nose. And this is why I think that this doesn't make sense for you. And same with the face, I want my jawline to look like that. Well, your bone structure isn't such that you can ever have a jawline like that unless you had implants in your jaw, right? I mean, there are these important moments in time where people just don't know. They just don't know. They see everyone's filtered, everyone's like something that maybe they aren't. If I can quickly do like a rhinoplasty morphing and show them what I would do for them, like they could do the same thing with an app and they're thinking it's that easy to achieve, but it's not. And there's risk benefit and everyone has to understand what that looks like.
Yeah, I find that the filter is actually kind of like one of the hardest, like patients will come in and they'll bring a filtered version of themselves and they'll say like, this is what I want to look like. And I'm like, there's actually no one in the world that looks like that. Like that's not like a real person. It's like we can always have a goal, but it's like trying to look like the filtered version of yourself is extremely aspirational. And it's one of the reasons that filters are so problematic because it does, you're like, oh, look, if I just had slightly higher cheekbones and if my eyes were slightly more rounded and if my lips were just like, it's just like, but it's like, no, you just changed your eye shape. Like that is like not an easy thing to do. So let's talk about facelifts. Like, are there different types of facelifts or is it because I hear some are like a little tuck or a little neck lift or, are you moving the SMAS with every facelift? Like, tell me about that.
Very good question. I think it can be very complicated. I'll say in general, like anything surgery wise, even if you talk about laser treatments, like which type of neurotoxin to use, it's all in the provider, right? It's whatever the provider feels like they can get the best results from. That having been said, there are some that are more long lasting than others. And the duration of how long a lift stays and gives you what you're asking for depends on so much. It's your anatomy, it's how your skin, just how your skin ages, right? And how your soft tissues age. I have some patients in their 40s that look like they're in their 60s and vice versa, right? And so those people who look older, younger are going to tend to age at a slightly quicker pace. Okay. So that having been said, there are 1,000 different names. There's the ponytail lift, there's the natural lift, there's the this, there's the that. And then you get into the more standard, and that's marketing, right? That's marketing, creating a brand.
Yeah.
It's not a like surgical technique necessarily.
It's like baby Botox. It's just
Totally.
a word.
Totally. Exactly. Which means so many things to so many people.
Yeah.
But there are kind of standard, longer lasting techniques. And those two are subsmas, which is below the smath, sub meaning below, and smas is the muscular layer that we're lifting and holding in place. Doing a skin only facelift is a thing, I think, of the past.
Okay. Yeah.
Skin only maybe lasts a year, and then what? It doesn't do great. It's not a long-term solution. The other problem with it is those incisions tend to be a little bit less attractive because you don't have any of the deeper layers that are holding things in place. So there's lots of reasons to shy away from a skin only, but then there are application techniques where you're kind of taking the that muscular layer and folding it on itself. There's imbrication, lots of varieties around the smas, but the two big things are a subsmas, which you can end up in the deep plane, which is the big phrase that people are always talking about. The technique is deep plane. You can still get into the deep plane through the subsmas approach, or you do like a traditional or modified deep plane. So those are the two that I would be thinking about in terms of giving you the most longevity, the most natural look, the best chance of like nice healing around the ears for those incisions. And they really take those deeper structures and put them into place and hold them there. Either some people use temporary sutures, some people use permanent sutures, lots of variations of the theme. But again, it has to be whatever the surgeon is comfortable with and feels like they get the best results.
So what's the difference if like a surgeon would decide between the temporary or permanent sutures? Does that have an implication on how the lift like heals or performs?
Not really. I was trained initially to use these permanent sutures. And then, sometimes when they spit meaning they come out of the skin and you have to remove them, they can become problematic. They can become infected, that kind of thing. But it doesn't mean that it's not the right technique or the right choice. We ended up starting with a different type of suture that dissolves. The other nice thing about the dissolving sutures is this type of suture takes a long time to dissolve. So it's not like it's gone in a week. I mean, it's months for it to go away. So it heals and creates fibrosis, scar tissue where you want those layers to stay. So you still have the benefit of those sutures staying in a pretty long time. And then if you feel like a knot in the back of your ear, it goes away because that suture eventually dissolves. Some people are a little bit bothered by permanent sutures because they can feel it, especially the very thin patients with thin skin.
Interesting. And I've heard that someone should only have two facelifts in their lifetime. So one, is this true? And if it is, should you push the first one off? And if it's not true, like, is there a number of facelifts that one could have, or maybe like a max number you've seen that was still viable for the patient?
I mean, the sky is the limit. You can find somebody to do anything to you. Yes. But do
true.
I think that makes sense? Do I think that maintains a natural appearance? No. I think, I don't want to give a number to it because I think that it really is person dependent. And the age in which it's right for you to do it is when objectively there is enough going on in the lower face and the neck that it makes sense to do in a risk-benefit analysis, and that it bothers the patient. If it doesn't bother the patient, don't touch it, right? But if it bothers the patient and objectively you can say, yes, I see why that bothers you, then it's reasonable to do. So if your first one is in your late 40s, which is on the earlier side for sure, then and it lasts, let's say, 7 to 10 years.
Okay.
By the time you're not that, not that much older, you might be thinking about doing it again. Right. So then when do you stop?
Yeah, I was like, wow, that's actually
Right. So a lot of people think
that's a
about
lot of
facelifts as
facelifts.
being correct. So a lot of people think about facelifts as being like a one and done, or like, how come I don't look like I did immediately post-op? I mean, you continue to age, right? So whether you have
Yeah.
surgery or you don't have surgery, we have this problem all the time when we talk to people like, okay, well, especially with filler, right? If you're using filler you might need more filler because you're having more signs of facial aging. And so you really have to think about like when the right time is, and then kind of remind people that it's okay to age, right? I spend a lot of time with my patients. I think aging is amazing, right? Like what a privilege it is for us to age, but we should do it if we want in a way that enhances our natural beauty, that makes us look as good as we can in this moment. But we can't be going back in time, right? We can't be going
Hmm.
entirely back and say, okay, I'm 50, I want to look 30. I'm 70, I want to look 50, and then keep on that train, because you're never going to be happy.
I see a lot of millennial patients, and this is like such a like hand-holding moment because
Totally.
millennials particularly, they're like, I've been using sunscreen, like I get Botox, like I am being proactive, like I should not age. And I'm like,
Well,
no, like yeah, like you're aging well. Like
right.
that's like the point. Like you look fantastic for your age. Like if you know you we look at all these, here's a 30-year-old now versus a 30-year-old in the 70s. Like
Totally.
that is what you're going for. But like
Totally.
no, like you are going to age. You are going to get a wrinkle. Your face is going to start sagging. Like these are all things that are going to naturally happen. And I think that there's just been this whole kind of like misunderstanding where people think that because they've been very thoughtful about their skin and they've been very thoughtful about aging, that they could actually pause the process. And there is no
Totally.
pausing
Totally. And
aging.
there's no pausing. Yeah.
Yeah.
No, it's true. And then in their 30s, they start looking at their moms and their grandmas and their dads and their grandfathers, and they're like, oh my God, oh my, I'm like, they're like having these moments. And you're like, yep, like that's where
Yeah.
you came from. And let's see what we can do to help
Yeah.
you feel good about where you are now. And you're right, it's more than hand holding. I think we have the privilege and kind of the responsibility, being in aesthetics, to really take that time and talk to people and have them feel good when they leave our offices, right? Like
Yeah.
it's so
Yeah.
important, and I'm such an advocate for that, and to realize like, yep, you're aging, but you don't have the sunspots because you were awesome about your sunscreen, or you weren't awesome about sunscreen before, but now look at you, like you look so much
Yeah.
better. You used to smoke and now you're not smoking. I mean, tobacco is, that and sunscreen and retinol, right? Like those are
Yeah.
the big things. And if you can avoid those things, you're going to do better in that process. But you're right, it's tough. It's really tough.
This is a podcast. We're not Uber, but I'm still going to ask you to give us a 5-star review after listening today. Thank you.
You mentioned you've dabbled into this concept of like hyaluronic acid filler. So
Sure.
I feel like I honestly try to stay off skincare TikTok. It scares me. I know Ian.
I partake a
But
little
I feel
bit.
like there is a lot of chatter going on about, filler and how it could potentially complicate facial plastic surgeries. And so like I know there's some plastic surgeons or some people who do plastic surgery who may or may not be plastic surgeons who are like, you should never get filler because if you get filler, then you're going to have horrible facelift results. You're going to have horrible blepharoplasty results. Is that something that you see routinely, or is that like a subset of people who've had a lot of product and that product just hasn't had enough time to dissolve? Like how much is that complicating your work?
It's a really good question. So, if somebody's coming to me and they're sort of teetering on whether they want surgery or whether they want like a quick fix, I'll say, how soon are you thinking about surgery? Because if they're thinking about within like 6 to 9 months, we definitely stay away from filler. And we just say, let's just
Yeah.
live the way you live and then let's wait. And the reason why is because then I can see better. I can see how much we need to lift. If we've got filler in places it shouldn't be, that's going to eventually go away, then you end up with saggy skin later. No, you don't want that. You want like the
Yeah.
result that will give you the longest duration. So if I know they have filler in, I'll dissolve them. But even
Okay.
dissolving isn't like 100%, right? You don't necessarily get all of
Yeah.
it. You can certainly see filler. It looks like these little globs of things underneath the skin. And that's always interesting. You're like, what is that? Oh, I know exactly what that is. It's filler, you know? And same with thread lifts, you know, you're like, oh, there's the thread. Let's pull that guy out. You know, so you really,
Oh my gosh.
yeah, it's nice to like have a clean face and to be able to make it easier. I'll say that hyaluronic acid fillers I'm happier with intraoperatively than other fillers that create more dense scar tissue and some
So
other,
like Sculptra.
yeah, Sculptra, Restyle. I mean, there's stuff that tend to make more scar tissue, and
Yeah.
they're building collagen, but it's not the same collagen that is like boosting a more youthful appearance necessarily, right? I do think that there should be a pause if you're thinking about surgery and seeing if you can wait at least a year, ideally a year, for the filler that you have done to come out or to start dissolving it. And certainly it takes sometimes a couple of times in the office to dissolve. It's not always a one-shot deal. So just giving yourself a little bit of time to do that is smart. Oh, do you know what actually I'd love to talk about? Is
Yeah, tell me.
tear trough filler when you're talking about the
Yes.
eyes. Okay.
Oh yeah. So we talked about Bless. Yeah.
Okay.
Yeah.
So tear trough filler can stick around a very long time. So it can
Yes.
stick around for 10 years. And you
Yes.
have it one time, you don't even think about it. And then years
Mhm.
down the line, you're like puffy on one side or you're puffy on two sides, can't figure it out. I had a patient with a huge workup about why she was puffy underneath her eyes, couldn't figure it out. And all I did was dissolve her. So
Mhm.
I think we have to be mindful that tear trough filler is different than filler in other places in the face. That's true for a lot of reasons. But if you're thinking about eyelid surgery, you really want to make sure that if there's anything in that area, that it's dissolved.
That
So
makes sense. And I definitely think people overdo tear trough filler because even when I counsel patients, I think it's a little different for like very young patients. I think that they do metabolize it to some extent. But a lot of times I'll tell patients that your tear trough filler will last longer than it's useful for. And so,
Totally.
it's not uncommon for like at 2 years, exactly what you're saying, where it's like puffy, it's not giving you the aesthetic result, and we actually have to
Dissolve
dissolve
it.
it
Yeah.
versus other places where we kind
Yeah.
of
It goes
assume it
away.
is
Yeah.
just like naturally
Yeah.
metabolizing. There's just like not much happening in that area in terms of metabolism.
Yeah, and I think it's just good to kind of counsel people on that too, just so that they know that if something were to come up down the line, like not to panic, that it may be related to the filler,
Yeah,
right?
exactly.
I
Yeah.
mean, that's part of it for sure.
I think it's been maybe 5 years. I had like a little bit because I had like
Mm-hmm.
slight lines under my
Mm-hmm.
eyes, and I did it once, and I think it was 5 years ago, and I'm like, it looks like I still have it. Like
That's
Yeah.
I'm like,
amazing.
yeah.
And I think
Blessed.
that that's something that happens with filler where that's how people get overfilled is that it's really important that you have a relationship with the person who's doing your aesthetic treatments. Because I have patients that will come in and they'll be like, oh, like it's been 2 years. Should I do this? And I'm like, no, you look fantastic. Like
Yeah.
your cheeks, like your filler's still there, like you're still
Mm-hmm.
lifted. And I think that sometimes people, because there is this instant gratification or like this, like,
For sure.
you look really good
Yeah.
right after filler. So I think people are like, like, should I do a little bit
Yeah.
more? And it's like, you have to have someone who's going to be objective
Yeah.
because I mean, honestly speaking, it takes me more time to talk someone out of
A
filler and I
hundred
make
percent.
significantly less money
100%.
when I do it. And so you really have to have someone who has your best interests at hand because it would be really easy to say like, oh yeah, let's just add like a half a cc here. Let's just
Mm-hmm.
add 1 cc here. And that's how that like morphine and that overfilling like starts to happen.
And
But yeah.
photos, right? So like when you do
Oh yeah.
fillers, like you really should have pre-filler photos so that you can go
Yeah.
back and you can say, well, this is what it looked like before. Like you patients really need to see that sometimes. And when you don't do that, you put yourself as a provider in a bad position and also the patient because they don't know where they used to be. And so it's harder for them
Yeah.
using without having standardized photos to really see the difference.
Especially with filters, because I feel like it's very common that
Oh
people,
yeah.
their personal photos, even if it was 5 years ago, it's like they might have face tuned it or photoshopped it, and
Yeah.
Yeah.
like, they don't remember that that photo's actually altered. So they're thinking that's what they looked like in real life, but it was filtered back then. And so
Yeah.
that's,
It's actually so true. I look at photos of myself and I'm like, wait, is this what I actually look like? Or is this an edited photo? And I can't tell the difference. And so
Right.
I'm like,
And if
I
you
went
can't
to,
tell the difference and
yeah.
you're in aesthetics,
yeah,
it's like, why could anybody else across the street
yeah.
be able to tell?
I,
Yeah, no, it's
I,
true.
I think there was this phase where everyone, well, it still happens, but they were super edit happy, and like I'm guilty of
Yeah.
it, but I would like take like the whiten tool and I'd like be like, oh, let me whiten my teeth, and then I will look back at those photos and I'm like, okay, I know this is edited because that's like pure white veneers that like would look awful in real life. So like, what was
Right.
I thinking?
Yeah. That's
Yeah,
so funny. You're like, that's edited. Yeah. The teeth, the
totally.
telltale.
Totally. We're talking plastic surgery. I think years ago it was clearly taboo. I think there's still a bit of taboo that exists around it, but it's clearly like becoming more common. Like last year I had liposuction and was very public about it. And then since then, I feel like I've seen other creators posting, oh, I had lipo
Mhm.
or I had this surgery and kind of sharing their story. So now that plastic surgery is having sort of this resurgence in a less taboo way. Do you think there's like any specific things contributing to that? Have there been new techniques or like technological innovations within the specialty that have kind of gotten us to this more publicly accepted space?
It's a really interesting point. So I think COVID was really big because everyone's on camera and they're looking at
Yeah.
themselves and they're like, oh my God,
Yeah.
what bothers you? And everything bothers people when you're staring at yourself all the time. And so I think that was kind of a big turning point within plastic surgery, or especially facial plastic surgery. The other nice thing if one good thing or two good things came out of COVID, is that people had downtime, right? So they could go off
Yeah.
camera, have their surgery, and then still be working and still be in the mix, and nobody's looking at them twice being like, how come you're not in the office? So I think that's one thing that really truly contributed to plastic surgery being less taboo. The other thing is we have a lot of non-surgical techniques that have kind of become more popular, right? And a lot of people are like, I see an improvement, or I feel like I've tapped out on this. And if this costs this amount, but I could have surgery and get a more permanent or semi permanent result, I might be heading more in that direction. So I think it's almost like people toed in the water a little around this, and we're choosing to do different treatments and then realizing they're not actually getting the results that they want. And so it became more comfortable for them to think about surgery as an option.
I think Kybella is like such a great visual of that because with Kybella, it's a non-invasive procedure. People don't want to have liposuction. They don't want to have like an invasive procedure. But then they're doing this treatment, like 3 treatments, and they're swollen and
And they
they're
have a
painful and it's
bullfrog.
really expensive. And like they're like, oh, I should just go get liposuction.
Yeah, I know. I
Like I
mean,
could just have the like one downtime. I pay the fee once and then like I'm gonna get a better result. So
yeah, for those
yeah.
patients, I do like one tiny poke hole here and I
Yeah.
just suck it out and then it's done,
Yeah.
right? It's not a huge incision for what we're talking about, Kybella, liposuction candidates. And it's so easy.
Yeah.
I think especially for laxity, I think with a lot of the devices, and I'm the first to say like I love to try different lasers or ultrasound tightening,
Same.
like all the things, but I think for someone who is at the point where they are a candidate and then maybe they've been like, oh, let me just go the non-surgical route and, you know, do 5 different modalities and then realize, oh, I'm not as lifted as I kind of thought or maybe
Yeah.
was marketed
Hmm.
to. And then it's like, oh, now I need to actually go still do that where, those are more supplemental and like more maintenance and not going to fully change someone's face. Same thing with skin. Every time someone gets I give someone a
Hmm.
facial or they get like a peel, it's like they kind of like look and they want glass skin, but it's like it's not as easy just to do like one treatment. You're
Hmm.
not.
Yeah.
There's a lot of factors
Yeah,
here.
yeah.
There are a lot of
Yeah,
factors. Yeah. No, that's exactly right. I think, thinking about surgery and skincare, they're complementary, right? There's a lot of overlap. There's some skin tightening that you can do. But even like doing a facelift, if you have wrinkles and brown spots and you know, whatever other skin issues you
yeah,
have, that's not going to solve that problem. So a laser on top of that is really nice, or some like, radio frequency microneedling is really nice for maintenance. There are lots of things that you can be thinking about, but it's multifaceted, right? It's not just, okay, you have the facelift, you're done. Well, then it's smart to
Yeah.
maintain it. You've already put in this much time, money, and effort. And now twice a year, go and do something that kind of zhuzhes you up a little bit and maintains the skin health.
Okay, so for our listeners who are considering a facelift, obviously everyone in New York City is going to book a consultation for you. But if in general, how should someone go about finding a plastic surgeon? Should they be asking their friends? Should they be looking online? Should they look into what procedure they're interested in and find a plastic surgeon who like specializes in that? Like, what is your kind of recommendation?
I think it comes from a lot of places. So it comes from, ideally friends who you've seen how they look. And then, like, I have a lot of patients who are like, she's going to go first and then I'm next, I want to see how it goes. And they'll come in together and say that to me.
Yeah.
It's like, it tickles me. But that's a really nice way of doing it, because you feel like there's a point of connectedness. You're seeing them like out in the wild. You're not seeing potentially edited photos. I mean, there's so much photo editing that goes on. And I find it really upsetting, because I think it's a misrepresentation, obviously, of what the product is. And patients then think that they're getting something that they aren't getting, right? But I think in lieu of being able to have that best friend who did it before you, who was brave and did it, there some online research can be helpful. Going to your complementary subspecialties like your dermatologists, the estheticians who have seen those patients in their own practices, and they see how they did, how they healed. Those are really nice ways of finding a more connectedness than just a Google search, right?
I love that, actually.
But let us not forget that Google reviews are important, and people don't always want to share on Google reviews, but they're very honest. Those who do are honest. And so take some of them with a grain of salt, right? Take the really
Yeah.
horrible ones with a grain of salt, and take the ones that sound forced and fake also as a grain of salt, and look in the middle and see what the general vibe is of the provider, right? It's not a bad way of just sanity checking to make
Yeah.
sure you're finding somebody that vibes with you. And then go on a couple consults. Go on 2 consults. Don't go on 10 consults. It's very confusing. You can't remember. I mean, it was like going on residency interviews, right? You go to like 50 different places and you're like, wait, hold on. Where, or like, does that place do this? Does this place, how's my experience here? So it's really nice to have just like a couple of touch points where you're like, okay, I saw 2 doctors, or I really jived with this person and I'm happy to move forward with them. That's also a great outcome, right? You don't have to have that second consult, but if you're unsure and you just need a little bit more reassurance, it's nice to see somebody else.
I think that's a good point about the consults too, is it's always important to remember that like medicine, especially aesthetics, is an art. So you're not looking for the right answer. I think sometimes people will come in and they'll be like, what's the right thing for me? And it's like exactly what you said. It's going to be different for different physicians, because their expertise and their practice skills are going to be, you just have different preferences.
Mm-hmm.
And so you really want to like trust this person that you're moving forward with, that they are doing the right thing for you, not like, oh no, I should get this exact procedure with like I heard about dissolvable sutures and you're doing like lasting sutures,
Exactly,
like it's like
right.
Everyone has their own technique. And so don't kind of like feel like, okay, I'm going to go see a bunch of people and then the answer that I hear the most is the right thing for me. It's really picking the right person for you and being trusting that they're going to give you their expertise and they're going to give you their best.
Yeah. And I think the other thing is, just because somebody's the most expensive doesn't make them the best, right? So I think sometimes we kind of think, oh, well, they cost this much, they must be the best. Not always, right? I mean, sometimes they're really fantastic, but there's also like no best. There are a lot of really excellent people in all of our fields. And just appreciating everyone for their own skills is also important.
I think the call out about it being an art is so important. I had a friend who she's been debating getting a rhinoplasty, and when she talks about doctors, I think she maybe did two consults, but she was talking about one specific doctor and was like, I really like how he does noses. But she wasn't say like, I like this nose, like the picture example. It was more like, well, looking at oh, this person had this type of nose and now it looks like this. And someone else has this
Yeah.
different type of nose and now it looks like this. So that like subtle artistic shift, and her analyzing that and being like, oh, I feel like if he did that to my nose, it would still fit her face, etc. Like I think
Love
that's how
that.
she was reasoning
Love
it. So I
that.
think the
Yeah.
whole artistic call out is like we got to double down on that because I do think that's a good reminder for everyone. It's very much an art.
Yeah, I mean, I've had people bring in pictures and they're like, "This is what another doctor suggested my nose look like," and he said, "Well, oh, it looks like every other nose that this person has done," and it shouldn't. In my opinion, right? Unless that's what you want and you love that one single nose that they do. But you're absolutely right. It should be varied for the person. And keep in mind everything that we talked about in the beginning of the podcast, right? Facial shape, ethnicity, goals, their personal aesthetics, and it should conform to that as much as possible.
Hypothetically, I decide to get a facelift, or whoever, it doesn't have to be me. We
You're
have
not ready.
yeah, we
I'll
have
be in your office tomorrow.
Didn't we
I'm
talk
not
about this? No.
yeah, don't worry,
Don't
guys.
do
I'm not
it. Don't do
I'm not
it.
considering. We have a hypothetical patient.
Uh-huh.
They book surgery with you. They know when they're doing their surgery. What's kind of like the optimizing results checklist? What do you recommend in terms of diet? Are there specific medications, supplements, any types of exercises, or what's like the optimal protocol? Not me, but for your patient coming in for the lift.
We could talk about this for an hour. I do a whole big like pre-op appointment that's about 3 weeks before surgery, just to make sure this exact thing you're talking about, that people are doing everything they can do to give them the best results possible. The number one thing that I always screen for in any initial consult is tobacco. So if they are smokers, that's months that they need to be off of tobacco because it inhibits healing, high risk of significant scarring problems at the end of healing. So I really harp on that. Beyond that, for a non-smoker, I tell them to maintain an anti-inflammatory diet. You can't go wrong, right? You cannot go wrong by eating healthfully. Lots of green leafy vegetables, good proteins, not starving yourself. You need that protein in your body in order to have the best result. Speaking of like just healthy eating and stuff like that, they have to also be at their kind of maintenance weight. So 5 pounds up and down is no big deal. But if they're on a weight loss journey, I want them to be stable for like 6 months. It's not fair to them to go through a whole surgery and then to lose that extra 30 pounds that was like pretty stubborn, and then they have saggy skin again, right? So you really want to make sure they're maintaining their weight. And then like immediately pre-op, I tell them stay away from Advil, NSAIDs, which are Motrin, Advil, Aleve, that kind of stuff. There's a whole list I have of aspirin-related products that can also increase the risk of bleeding because we're trying to prevent a hematoma or a blood collection underneath the skin. And if that happens, can be a whole to-do, potentially back to the operating room. Some can be managed locally, and other times it ends up creating extra scar tissue because the body has to get rid of that blood clot. So, those are really important things to stay away from. They need a pre-op evaluation from their primary care doctor, tick all the boxes, make sure they're in their most healthy state. And sometimes things come up and you're like, I'm so glad we talked about this. I'm so glad we got this. Now we can make sure you're healthy and we can just kind of push out surgery a little bit if necessary. But most of the time everyone gets cleared and they're just kind of in their normal maintenance, but it's super important. And I like arnica. I like bromelain. There is no good evidence in like my literature for it to be like this fantastic medication. And it's also, there's no great literature to say it doesn't work. People love it, swear by it. And I think they're natural supplements that are helpful to take if people want to take it. And then staying hydrated, and there's no magic to it. It's all these things that you just kind of expect that your people are doing, but there's some nuance there.
The magic's in your hands when you actually do the
I
surgery, and
mean,
it's
I'm
the art.
trying. Yeah, yeah.
Talk to us about healing. So, rhinoplasty versus like a deep plane or subsmax facelift. Like, how long are they hiding in the house?
Okay, so hiding is also different per person because some individuals are like, look at me. And other people are like, if I have one bruise on my body, like I am not going out in public, right? So it really varies. It's like pain tolerance. Some people can tolerate a lot of pain for the exact same thing you're doing. And somebody else is like, put me under. I can't handle it. This is too much for me.
Yeah.
But in general, I tell people for either, the bigger surgeries like the rhinoplasties and the facelifts, I tell them to take a week off from work or school because you really need that downtime to give yourself a break. Even for like my minor procedures, I'll tell people take a week off, but if you can get back on and you're feeling good, fine, go back online and do some work. But in general, rhinoplasty, facelift, you're taking a week off, sometimes 2 weeks. So that first week,
I was like, a week is no time.
well, I know. Isn't that great?
That's like a vacation. Oh my God.
Yeah, but are kids involved? Are they running around? Like less of a
That's
vacation.
true.
But a week where you're a couch potato. So not an invalid, but like a couch potato, just hanging out, relaxing, sitting in the couch, sitting in the bed, sitting in a chair. With my facelifts, I will say I also send a nurse home with them that night, that first night, and then they can opt for additional time. That way they don't have to worry about a thing. They just get
Wow,
taken
that's,
care
yeah,
of.
amazing.
They know the medication, they know what to look out for, and it just makes it a really pleasant experience for patients. So
Oh, I love that.
I know, isn't it great? I feel like I could use a nurse every once in a while. It'd be so nice. So great. Especially when our kids get norovirus. Week 2 is more activity. So you're walking the dog for the dog's exercise. So I tell people walk as much as you want, as much as you were walking before. I want to get the blood pumping a little bit, but not so much that they start bleeding or having complications, right? So that's the dog walking week. Going into your third week is when personally, I let people weight lift. I let them stationary bike. I let them walk on an incline. I just say 4 weeks before you can start running or doing anything that really pounds the pavement.
Awesome.
Wow,
Not too
that's
bad,
actually
right?
not bad. Yeah, that's actually really not that bad.
Yeah.
And then in terms of a facelift, when do they feel like the results are settled? Like for rhinoplasty also, like swelling's gone down and they're like, if you were timing this for your daughter's wedding, like when would you get a facelift?
6 months. I would say
Okay.
6 months, not because it takes 6 months to see the result, but in case there was something that happened, you want to give yourself a little bit of runway to let it resolve. You could do a little sooner, but God forbid you had a complication. You don't want to be
Yeah.
having that on your mind during a stressful time. 3 months, I'll say in general, for most things is your like quote unquote final result. That having
Okay.
been said, it takes a full year for incisions to mature and become what they're finally going to look like. So there's still healing going on, but I'll generically say about 3 months. When do you look normal after a facelift? About 2 weeks. Sometimes like 3 weeks, you can go out into the wild and nobody's going to look twice at you. Sutures are in for a week. So that's the time when you're a little bit more, I guess, like post-op, you're sitting around.
Yeah.
It's also a good time to just relax. But, your hair covers around your ears. And so depending on where your incisions are, it may not be so obvious. And then for rhinoplasty, this is like the biggest challenge because it takes a year and a half, 2 years to really see the final results. Doesn't mean that you're
Wow.
not going to see an improvement when you're off the table and you take your cast off. It's just that it takes a really long time for the skin to shrink down onto the framework underneath it.
2 years.
Wow.
Wow.
I did not know that. Yeah.
But by 3 months, you like 60-70% of the swelling is gone and it's that additional 30%. But in the small space, if you have 30% of the residual swelling, it's a lot, right?
Yeah.
So some people hold on to a lot of water and maintain a more swollen appearance than others. And others, you take the cast off and you're like, it looks like I didn't do anything. Like, how magical for you. Like, you're the lucky one,
Yeah.
And it's really a wide variety. And thick sebaceous skin, which you and I have talked about, Dr. Love, that tends to be the type of skin that holds on to swelling longer. And there are new techniques that we're kind of working with our derm colleagues to help get that skin to shrink down a little bit better and faster.
Wait, can you elaborate on what's that technique? If someone gets a
Dr. Love, you're the the arbiter of this.
Well, you're the expert, but yeah, so we have a shared patient where we actually did isotretinoin post-op of her rhinoplasty, which is kind of like a big change in the industry because from a derm perspective, we are always told like, and I think from surgical perspective also, there's this big like no
Totally.
isotretinoin within 6 months of surgery. It delays wound healing, and so it's kind of an exciting case and an exciting change because I feel like we're allowing our patients to do a lot more on isotretinoin, but we're also really realizing that isotretinoin can be really helpful in actually augmenting and improving surgical outcomes. So it's pretty
Absolutely.
cool.
Absolutely. So that's sort
Yeah.
of the like a more modern technique that we're doing in combination together, which is I always love working with colleagues. So it's fun to work with Dr. Love with this patient in particular. And some patients will start it before surgery, but most of the time it's sufficient to just start it afterwards. And then we kind of work together to see when to stop it. And there might be other reasons why the patient might be on it longer. You can do a lot of things. You could do massage that helps get the swelling out faster too. Taping. I really like massage better than taping. I think it actually does more and helps the lymphatic drainage. And then steroid injections. I tend to be steroid light. I'd rather see that people are kind of healing naturally on their own. Everything comes with risks. And so you have to make sure you're putting those two together. So what are the risks of doing this versus what are the benefits and how quickly do we need the swelling to come down?
so interesting. I love that. I love the collaboration.
Oh, me too. It's so fun.
It's fun. It's so fun. Yeah. So we talked about blepharoplasties like briefly,
Mhm.
but and we talked about is it too young to have a facelift? Is there a too young age for a blepharoplasty? Because I have a patient who like she was 23 and she was like, I'm gonna go for bleph. And I'm like,
Really? Yeah.
23?
Yeah.
Yeah, but like do you think it's similar, especially when because you're gonna have to have revisions, correct?
Not necessarily. I think bluffs
Yeah.
are one of the things that are often a one and done.
Mm.
That having been said, I do revision bluffs, right? For a reason because people do age. But I think that there are a subset of patients who are very young in their 20s with big bags under their eyes. And they will tell you,
Yeah.
my mom has it, my dad has it, this person has it. And that is anatomy. That is just the way their orbital
Yeah.
fat sits. I don't think it's too young. I had a very similar experience and I reached out to one of my oculoplastics colleagues and I said, here's a picture of my patient. And I said, she's very young. Is this wrong to offer this to her? I
Yeah.
feel like I see what she sees and I want to be able to help her, right? And my oculoplastics colleague said, no, it's the anatomy, right? It's okay that she's young. It's just so unusual to see somebody that young. But how hard would that be for that young person who has big bags underneath their eyes? It doesn't matter how much they sleep. It's not allergy related. There's no cream in this world that can get rid of those bags, right? So
Yeah.
to be able to offer them an alternative and something that is permanent or semi-permanent of something that really gives them some insecurity and discomfort looking at themselves, like how wonderful is that? So no, I don't. At the end of the day, there's no age that's too young, but I wouldn't do it in a teenager. That would be like a
Yeah.
20 something would be kind of the earliest. And we would really have a conversation and I would have to make sure that they understood what they're getting into, right?
So would that be mostly for lower bleph, or what about an upper bleph?
It's more common in the young patients who have periocular premature aging to be lower, but there are some people in their 30s in their early 30s who have a lot of heaviness on their upper eyelid. Um, I tend to push those patients off a little bit because I can help with like a little neurotoxin brow lift to raise that, and that takes off some of that heaviness that they feel just to get them a little bit closer to a more common age for this. But if somebody's like, I got to just be done with it and their brow position is, normal, then it's reasonable to do. But yeah, I think there's more flexibility in the upper bluff and the lower bluff. There's no hiding it, right? There's no amount of
Yeah.
filler that you can hide it. You can't you can contour all you want, but the light hits where the light wants to hit, and it is what it is.
This was fantastic.
Thanks for
I
having me,
could talk to
guys.
you all day.
So fun.
Thank you so much for sharing your time and your expertise with us. I truly learned so much, and I feel like this is going to be such a valuable reference point for so many people.
Great. Thank you.
Thank you, Dr. Lafer.
Right.
Yeah.
And thank you guys for listening.
Our DMs are always open.
We're always looking for new show ideas.
Just ask us skincare questions.
Let us know what you're beauty curious about.
Give us a follow over
at our Instagram @BeautyCuriousPod
to see snippets from each show. Thanks for watching.